when I was in, I think it was my 9th or 10th grade year, I took an anatomy class and I was like, the body, it's amazing. Like, I love all the muscles, I love all the interactions of the body. I was like, this is something that I wanna do. I'm Kendra Moore. I'm from Midland, Georgia, right outside of Columbus, Georgia. For elementary school, I went to Pinehurst Christian School, and for middle school, I went to both Grace Christian School as well as Arnold Magnet Academy. For high school, I went to Columbus High School. Go Blue Devils. For undergrad, I went to Georgia Southern University, and for medical school, I'm now at Mercer University School of Medicine. And so I was talking to my mom, and she was like, Kendra, be more. And I was like, my last name is Moore, be more, you know what I'm saying? I was like, that's real cute, Mom. And so from that, I realized like, okay, look into more of the health field, see what you're interested in. And I was like, okay, I think I want a challenge. I really do enjoy helping people. I want to be able to educate people from what I know and what I understand, and also help better their health and better them as overall people. And I was like, I think doctor is the route for me. And as I've been in med school, like, it's definitely solidified that inclination. I'm like, be more. So I'm actually interested in peds. You can probably tell a little bit from my personality, like I really love being around kids. I love mentoring kids, being around kids, and uplifting them. And one thing that I always say is that representation is key. I didn't really know any doctors growing up. I didn't necessarily have that representation around me. So just me being in this position is very important for other Black and brown kids that look like me that might not see somebody in that position that they might want to be at or might not even know is a goal. So I look at it almost as I want to care for kids, but I also want to show them what they can aspire to be. I want to have a nonprofit be more in the future that encourages children to be more whatever their more is, even if it's not in medicine, inspiring them to follow their dreams, be who they want to be. I would tell a younger me, if I could travel back in time, to be more confident. Just reminding myself like, girl, you are Black, you are beautiful, you are bold, you are confident, you are intelligent. Like, reminding myself of that over and over again. What you put your mind to is possible. A statistic doesn't define you. You should be here doesn't define you. Like, people don't define you. You have to be confident in yourself and know what you bring to the table. So I would definitely tell baby Kendra, like, be confident, girl. As far as legacy, it's interesting because with a lot of the work that I do, it seems natural to me. It seems like something I could be doing. And for me, it's one of those things where I feel like it's kind of hard taking the credit for the places that I've been and the things that I've done, the things that I will do, because I know that I'm a vessel that's being used by God to reach other people. Continue to do purpose-driven work. And I feel like whenever you do that, regardless of I guess I should be speaking as in terms of my legacy, but I say that to anyone about the legacy that you want to leave. If you walk in your purpose, do the work that is leading you to that and helping you to walk within that, your legacy is set. You don't even have to think about it. Like, people will remember you and know you, and you're not even trying. Mercer Medical School, what drew me to Mercer? Primary care and caring for underserved areas. A lot of doing my community medicine rotation in January, I got to interact with a lot of different patients. I had an eye-opening experience about population health and health in general, which is inspiring me to also now go pursue a master's in public health so that I can learn how to better tailor my future practice in primary care to helping address those health disparities. Diversity is important in medicine in general because in having a diverse pool of students, you get diverse perspectives of background. You get to see different upbringings, different religious beliefs, lack of religious beliefs, all these different factors that play into diversity. And I feel like that's important because in having diverse classmates, that gives us more of an insight as to just how diverse our patient population will be. So diversity is important because it gives you that opportunity to see different backgrounds, understand different things, understand different cultures, practice not just cultural competence, but cultural humility. Okay, I understand that there's different cultures. I'm learning about them. Now I'm going to be humble and respect that. So I really enjoyed the fact that Mercer has that open field to where we can also talk and converse about these things so I can, in the long term, be a better doctor to my future patients.